Alright, this video is about sleep disorders. So you already read in your book about what sleep disorders are. Here I am going to basically I have 4 videos about each one: insomnia, narcolepsy, sleep apnea, and night terrors. Just to give you a little bit more information, and some of them are really good about talking with people that actually have experienced this type of sleep disorder. So starting with insomnia, insomnia is obviously where you have the inability to sleep, and most of us have gone through a period of slight insomnia where you have a hard time falling asleep, maybe for a day or two. But true insomniacs are going to be having this problem be chronic, meaning it's going to be continuous and it's going to be lasting a long period of time. So the video I have for you is talking about insomnia. And, oop, not good, hold on. All right, I'm going to do it this way. Oop.
My name is Rachel Sellis. I'm a sleep neurologist, board certified in both specialties. I'm Dr. Virginia Rumko. I'm a Johns Hopkins behavioral sleep medicine specialist. Insomnia is difficulty falling asleep, difficulty staying asleep, or sleep quality, or some kind of combination of those symptoms. And we all have a night of bad sleep here and there, but really what insomnia is, it's a more long pattern of a sleep problem. That's not only a nighttime issue, but it trickles into the daytime in some way, so there's some kind of daytime symptom. Whether that's just sleepiness or fatigue, struggling to stay awake at work, concentration issues at work, feeling coffee, or even just having a lot of worries during the day about the sleep. So typically, it's more commonly found in women. However, from kids all the way up to older adults, you can all experience it at one time or another. And most people have experienced it. When you're studying for a test or you have a very high-stakes job interview, you can suffer from some acute insomnia. But when that becomes chronic, usually more than 3 months, and you're experiencing it 3 or more times a week, then it can be actually a sleep disorder. Insomnia is diagnosed based on what you tell the sleep specialist. So there's no kind of lab test or blood work that you use that you have insomnia. You look at your medical history, psychiatrists can kind of describe your insomnia symptoms. However, sleep studies, the overnight sleep studies, aren't uncommon to do sometimes in insomnia patients because they want to rule out if there's some underlying sleep disorder like sleep apnea that can cause the insomnia. So insomnia is a complicated sleep disorder because there's always different factors for different individuals that are contributing to it. So the first thing that we look at is to see, what kind of behavioral issues that the patient that may be feeding the insomnia. So things like maintaining good sleep habits are very important, and those are things that we do investigate. A lot of times there's some simple things that patients can change to help as part of the treatment. There's several medications that are available. We typically try not to go straight to those because a lot of times they don't work, and these medications do have a side effect profile, so you have to be very careful when you give these. There is the mainstay, which is cognitive behavioral sleep therapy, and anytime I diagnose a patient with insomnia, I usually bring in my colleagues as sleep behavioral psychologists because they really help identify what factors are continuing the insomnia, and they help to set up a plan, a treatment strategy for patients to change their behaviors, because that's what the research shows has the biggest impact.
All right, so that was insomnia. There we go. Narcolepsy, on the other hand, is obviously going to be kind of the opposite of insomnia. And what you have with narcolepsy is you have somebody who is continually falling asleep. So
and how to kind of try to describe it to them. I found over time it's really difficult for people to understand it.
It's just very complicated with this tiredness, the cataplexy, the fragmented sleep at night.
If you're a normal person, you've got sleep and you've got your waking life, and occasionally they'll overlap a little bit. For me, I live in this world that is very rarely am I fully awake and very rarely am I fully asleep. I live in the in-between.
I'm Tom Scanlon. I'm a professor of neurology at Harvard Medical School. Narcolepsy is a neurologic disorder. It is one of the most common sleep disorders. It affects about 1 in 2,000 people. Doesn't matter how much sleep they get at night, they're going to feel sleepy every day. People also can have a variety of other symptoms. These include hypnagogic hallucinations, where they can have very vivid dreamlike hallucinations just as they're drifting off to sleep or just when they awaken. They can have something called sleep paralysis, where as they're falling asleep or sometimes when they wake up, they can't move. And then there's cataplexy, which is similar to sleep paralysis. The distinction is that cataplexy occurs right in the middle of the day, and it's triggered by strong emotions. And then the last thing, which is perhaps sort of one of the strangest of all, is that, for considering that somebody with narcolepsy is often very sleepy through the day, they often have fragmented sleep at night. They can wake up 4 or 5 times for 10 or 20 minutes for no clear reason. And so, in the same way that they have trouble maintaining wakefulness through the day, they can have trouble maintaining sleep through the night. Somewhere between age 10 and age 20 or so is when narcolepsy begins. People usually start off with sleepiness, and then the other symptoms follow.
yes, he
So
does
there's a
have
number
a whole
of different
brain
systems
right
in the
there.
brain that are involved in promoting arousal or wakefulness and sleep. Up here's the cortex. This is the front near the forehead. Here's the back. This is the brainstem coming down here. And this is the cerebellum, which is involved in balance. The brainstem is the site that most of these arousal-promoting signals come from. And those cells send connections up throughout the whole front part of the brain, and they help turn on the cortex and other parts of the brain when you're awake. There's also some cells in a small region called the hypothalamus that are involved in promoting sleep. And these sleep-promoting cells, one of the things they do is they actually turn off the wake-promoting cells. And so that allows you to be fully asleep without any hint of consciousness. This is called the mammillary body, and just above it, right here, is where the hypocretin neurons sit. And this is a really critical collection of neurons, brain cells, that makes very particular and special neurotransmitters known as hypocretin or orexin. Those are just 2 names for the same thing. The hypocretin-producing cells help activate and sustain activity in the other wake-promoting brain regions across the day. The brain contains billions of neurons, and only a very, very small number of these produce hypocretin. It's probably somewhere between 100,000 and 200,000, which sounds like a large number, but when you compare it to 10 billion neurons, it's really very small. In narcolepsy, those hypocretin-producing cells die off. When you look closely at the brain of somebody who has narcolepsy, what you see is about a 90 to 95% loss of the hypocretin-producing neurons. So there's 2 broad themes that are being pursued in narcolepsy research right now. One theme is to understand what goes wrong in the brain when the hypocretin-producing cells die off. How does that lead to sleepiness and cataplexy and other symptoms? Another big theme is trying to understand what actually kills the hypocretin neurons in the first place. Because if we could understand that, then it's possible that if one could diagnose and recognize narcolepsy right at the earliest stages, we might be able to get in and stop that process. As we've discovered more and more about what's actually causing the hypocretin neurons to die off, and as we've discovered more about the consequences of that for the brain, it's really given us a lot of hope for new opportunities for coming up with better therapies for people with narcolepsy. If we could get hypocretin back in the brain somehow, that would be potentially as great as giving insulin to people with diabetes. it would really be the missing factor coming back into play, and it could, in theory, cure their sleepiness and cure their cataplexy in the most thorough fashion. Right now, scientists are working with a variety of techniques to try to get hypocretin signaling back into the brain, but the hope is that in 5, 10, or 15 years, we may see those hypocretin replacement therapies coming into clinical practice.
All right, so that explains narcolepsy. So you have a loss of hypocretin cells. I have had a student, interestingly enough, in the same class that had insomnia, and then I had another student that had narcolepsy, and so they were actually able to speak to their experiences. And the insomniac was talking about getting, maybe 2 hours of sleep a night, and the narcoleptic student talked about how, if she didn't take her medication, they do have some medication, but it's, not perfect. If she doesn't take her medication, she talks about how she falls asleep in class, how, she could go to bed every night, at 7 o'clock and, sleep through. And if she doesn't have somebody wake her up, she's going to be constantly sleeping. There is different forms of narcolepsy. There is something called the Sleeping Beauty syndrome, where they will literally be asleep for days, but that's very rare. Okay, sleep apnea. How about Shaq on sleep apnea?
I snore? Yeah. See, I don't know if I snore because I don't hear myself, so.
Oh, he hears himself because sometimes it wakes him up. He's like, baby, was I snoring? Yeah, you were snoring. It usually happens when he's on his back, and then he gets into that deep snore like it's deep. And then he stops. His chest would stop moving and everything, like he was not breathing. So I nudged him like, babe, wake up. And then he'd catch his breath. I'm like, dude, you just stopped breathing in your sleep. And I say,
Pam's a registered polysomnographic technician.
Look how big he is.
Polysomnographic means sleep study. She'll be the one putting the electrodes.
Sleep apnea actually is a pretty common condition, which is most likely underdiagnosed and underevaluated because many people don't realize that they have it.
Well, every time I stop breathing, the next one, sleep apnea. Yeah, sleep apnea. I'm like, what is sleep apnea?
Well, sleep apnea is a condition where a person is unable to get air into their lungs when they fall asleep.
Every time the person stops breathing, they wake up. They stop breathing, they wake up.
And that exposes the body to a myriad of really adverse stresses.
That does have consequences.
Irritability, can't focus and maintain attention.
They're unable to sleep in the same bedroom with their bed partner or spouse.
There's about a 7-fold increased risk of motor vehicle accidents.
It's linked with the obesity epidemic to being linked with cardiovascular or heart disease.
High rates of stroke, diabetes, and even mortality.
So now we gotta fix it. Don't want to go out like that.
So, Shaq, one of the things that
I'm meeting with the sleep doctor, my main man, Dr. C. He said he wanted me to be part of his sleep study.
We arranged for an overnight recording in which we could actually find out whether Mr. O'Neill has sleep apnea.
I can guarantee they do not come to everyone's house.
Electrodes in the head. Now they're going to study the brainwave.
Look, that looks comfortable sleeping.
My REMs and my non-REMs. See, I read that. My rapid eye movements.
And the end is the what?
Non-rapid eye movements. So, hopefully I don't have it, but if I do have it, I know I'm working with the best people to, get it cured.
You all ready to go to sleep?
Yes, sir.
Okay, good luck with everything. We'll be here monitoring.
So the evaluation of sleep apnea is the test while they're asleep. And every second of the study will be looked at. Then the physician will interpret it and make a conclusion.
To cut to the chase, you have moderate sleep apnea here.
Obstructive sleep apnea is a chronic condition which is eminently treatable.
All right, so you said there's a mask, a mouthpiece, and surgery.
The treatment of choice as of today for sleep apnea is to go ahead with the nasal sleep apnea mask.
Is this forever treatment or is this a 6-week thing?
We generally regard this as lifelong treatment.
getting a mask to fit effectively is often a cardinal part of effective treatment.
There's a mask here that I can look at.
If a person is able to use the CPAP device, it works almost 100% of the time.
Oh yeah, this is pretty good. This is nice, I like it. Can I wear it to the club?
Yeah, absolutely.
This is nice.
Okay,
I like
good.
it. I'll do it. Since I've met with Dr. C, and I've been getting at least 7, 8, 9 hours sleep a day. I feel good. The weight is good. Got a lot of energy. The relationship is good at the house. Everything is working.
All right, so there's lots of good information there from Shaq about sleep apnea. If you know anyone that has really bad, deep snoring, that may be somebody who has sleep apnea. Although don't go and tell that person, yeah, you have sleep apnea. Maybe, maybe not. You do need to have somebody actually diagnose it, and there is possible treatment. All right, last one is night terrors.
I think it's going to take a long time before the general public really understands what a psoriasis patient goes through.
People stare and people look, but I don't care if they look.
Oh, sorry.
No, that's not shield on. That's shield on. And one piano.
After school at Annika and Ariana's house is a lesson in high energy. There are games to battle over.
What? I win!
Pokemon skirmishes to mediate.
No, that's not shield on. That's shield on.
And one piano bench.
I'm gonna act like it, but I'm just acting.
For two budding virtuosos. But the real sour note of the evening always came at bedtime.
What were the bad dreams like?
It was like, okay, this guy is creeping up on me and he's gonna zap me and those stuff.
There would be screaming and you know, she wouldn't know why.
Ariana's mom found these weren't ordinary nightmares, but night terrors.
She would wake up in the middle of the night and just, you know, be crying, or, you know, I actually would get to a point that I was just sleeping on the couch that I could make sure that I heard her.
A night terror is an arousal on a deep sleep.
Dr. John Suen has made a career of helping people sleep.
It's an example of a 5-year-old child.
This home video, he says, is a classic night terror.
You can see that there's fear, there's a lot of fright, there's crying. It seems to be inconsolable right now, having a hard time doing that.
Flailing as well.
It's because of, he's doing that out of fear. He's doing that out of fear. It's not any rhythmic motion.
A rhythmic motion could signal epilepsy.
Both sides of the ear, moving up and down when you're breathing.
And that's why Dr. Suen does sleep studies at his 2 centers on the Treasure Coast.
This little wire right here, right next to your mouth here, this little one that looks like an antenna, that's to measure temperature change.
Heather Smith's study will figure out other sleep problems, but about 20% of the night terror patients here get the same exam to rule out epilepsy and something called REM behavior disorder, which looks like this.
So it's where people act out their dreams. And usually their arms and legs are paralyzed, but in his case they're not.
As for night terrors, which adults can get, the medical world has not yet been able to come up with a cause.
We think that it's because there's some immaturity of brain circuits that regulate different stages of sleep, and it also regulates when you wake up.
This is an example of the phantom virus.
Licensed psychologist Mitch Spiro of Joe DiMaggio Children's Hospital helped Ariana draw away her fears.
Each week we would add an additional way of the child controlling the phantom virus.
If he gets hurt and defeated, I felt that if he was dead, then I wouldn't have any more problems.
She didn't.
She was in a better mood, and she was able to do better in school, and she had more energy.
And with a few props to help them,
is supposed to catch dreams?
The golden hair girls now sleep just right.
All right. So, night terrors, remember, are occurring during non-REM, NREM3. This is not during REM. Remember, the difference between a night terror and a nightmare is nightmare is happening during REM sleep. During a night terror, since it's occurring during stage 3 NREM, what happens is that it's very difficult to wake one of these children up. They are not paralyzed, so they're moving a lot, they're screaming. It's very hard to wake them up, and they're just inconsolable. All right, those are the 4 sleep disorders. Hopefully that helps. Let me know if you have any questions.
And how kind of try to describe